I've shot a lot of videos on what to expect after a surgical procedure. I do want to cover with you guys a couple short videos on what to expect after a small procedure like Botox and fillers. This short video is going to talk to you about what you need to know about after having Botox. Botox is a very short procedure. It's an easy procedure. It's a painless procedure. But there's things that you should know about the Botox experience right afterwards. First of all, you can have little bumps around your eyes that will go away in about 30 minutes. They'll be pretty much gone within 30 minutes to 45 minutes. So if you're scheduling a meeting or something, give me about an hour before that meeting occurs. The chance of bruising is very, very limited, although I have seen a lot of my patients have a couple punctate dots that could last 3 to 4 days, and if it's an inch outside of the eye, I can manage that area as well. In terms of overall bruising, very, very uncommon, but you want to go ahead and avoid vitamin E, fish oil caps, read that medication avoid list a week before, and try not to do Botox a week before a major social event, especially if it's your first time, because I really want to make sure that I get to know your anatomy, make adjustments so that I'm really good for you in terms of a customized care for you. Beyond that, the other thing is that the area right between the eyes is an area that I don't want you to touch at all. It's an area that potentially you could rub and push it down over the eyelid, and that's an area that I always say do not touch or massage or rub between the eyes. The other areas are relatively safe. Just between the eyes, an area I would be very careful with. For the first 4 to 5 hours. So don't lie down. For the first 4 to 5 hours, I just want you to be careful of rubbing this area. And no, I would ask you not to work out the day of the procedure after the procedure. No massage or lying down or rubbing on this area for the first 4 to 6 hours. And don't work out afterwards. You can work out before, don't work out after. The next day you can go back to working out. It's just an extremely conservative policy for you. In about less than 2% of my patients, you can have a severe headache for a day. It's extremely uncommon. And if that occurs, I know how to adjust my dosing so that that should not happen again. But that's extremely uncommon. But I have probably 1 in 100, 1 in 200 patients that I have a bad headache that will last about a day and it'll dissipate. That's important for you to understand. Also, the other thing is that if you're an active brow lifter, you're constantly lifting your brows, you may feel some weight to your eyes. And so what I always try to do is with my Botox is make the appropriate adjustments so that you don't experience that. But part of the thing about Botox, I always say, is that if you hate my result, don't worry, it's going to go away. If you love my result, great. Too bad it's going to go away as well. But I just want you to go through some of those thought processes with Botox so you know what to expect afterwards. I see all my patients 2 weeks afterwards to make sure that everything it looks good, and if you need touch-ups, those are free. I just want to make sure that if you don't need a touch-up, great. If you need a touch-up, great. Even something you may say it looks perfect, I'm pretty perfectionistic about my work, and I want to go back and look at it and go, you know what, I know you like your result, but I can do a little bit better. The touch-up is free, and believe it or not, I will address those little areas. That's why I always see my patients back, if possible, unless you're from out of town, 2 weeks after, just to make sure that what I've delivered for you is acceptable, it's perfect, it's as good as I humanly can. One more thing that I know that sometimes troubles my patient is that even though the brow may not feel heavy, when they apply makeup, they may feel it's harder to put makeup on if I do the forehead. And the reason is they're used to lifting the brows up to put the makeup on. And with the brows being a little bit less able to lift up, you may have a harder time putting it on. So sometimes you can still lift the brows enough to put it in. Sometimes you may need to lift it with your hands as you put mascara on. So that's something, it's not the brows came down, it's just harder for you to lift up. And if there's any questions, just give me a call, but I just wanted to go through some of the basic ideas of aftercare for Botox. Really nothing to do. Just don't lie down or touch this area for 4 to 5 hours. That's basically it in summary.